I've treated joint pain for over 20 years, and the patients who do the best aren't usually the ones relying on a single pill. As a rheumatologist, I treat arthritis and chronic joint pain, and one of the biggest misconceptions I see is this. People think joint pain is either something you just live with or something that only medications can fix. Neither has to be true. I had a patient a number of years ago who I was treating with an anti-inflammatory medication for severe joint pain in her hands and knees. She had a reasonable response, but she still wasn't able to do the activities she loved, including gardening and golfing. She told me at a later follow-up appointment that she had cut out dairy and gluten from her diet and started taking curcumin and omega-3 supplements. After 2 months of doing this, her pain improved substantially, and she was able to get back to the activities she enjoyed. That experience really made me stop and reflect. I began reading and learning about how dietary changes and supplements can work alongside medications for joint pain. Since then, I've taken a more combined approach, using diet, supplements, and medications when needed, and I've seen very good results in many of my patients. Diet can either fuel inflammation or calm it. Certain types of nutritional supplements can reduce inflammation and pain, and medications, when needed, can control disease activity and protect joints. However, medications are not always the first or only step. Dietary changes should always be part of managing joint pain. Even if you're using supplements or medications, diet still matters and should never be ignored. Why is this? Because food directly affects inflammation, and inflammation is one of the biggest drivers of joint pain. Certain foods commonly worsen joint pain in many people. These include sugar and refined carbohydrates. These spike insulin and increase inflammatory chemicals in the body. Ultra-processed foods such as packaged snacks, fast food, and processed meat promote chronic inflammation. Excess alcohol is especially problematic for gout and inflammatory arthritis. Highly refined seed oils should not be consumed in large amounts. Common examples include soybean oil, corn oil, and canola oil, which are widely used in fast food, packaged snacks, and salad dressings. When eaten in large amounts, these oils can push the body towards inflammation and worsen joint pain. Processed foods should be reduced and use simpler fats like olive oils that help calm inflammation. Some people feel better when they reduce or eliminate gluten. Gluten is found in foods like bread, pasta, and baked goods. The same is true for dairy. Because the response is individual, the only way to know is to test it in yourself. A reasonable approach is to eliminate one at a time, not both together, for about 3 to 4 weeks. That gives inflammation and symptoms enough time to change. If there's no clear improvement after that time, it's unlikely to be a major driver of your joint pain, and it can usually be added back. An anti-inflammatory eating pattern focuses on whole, unprocessed foods, vegetables, especially leafy greens, and colorful varieties. High-quality protein like fish, chicken, and beans, healthy fats like olive oil, nuts, seeds, and avocado, and omega-3 rich foods such as fatty fish like salmon or sardines. This type of diet helps by reducing inflammatory markers, supporting cartilage and connective tissue, and improving energy and mobility. Extra weight doesn't just put pressure on your joints like carrying a heavy backpack. It actually changes the chemistry inside your body. Fat tissue releases inflammatory signals that travel throughout the bloodstream and can irritate joints all over the body, including the hands, wrists, shoulders, and spine, not just weight-bearing joints like the knees and hips. That's why modest weight loss can lead to noticeable pain relief, sometimes in joints that aren't weight-bearing at all. Many people are surprised that losing a relatively small amount of weight can improve their joint pain. This isn't about appearance or the numbers on a scale. It's about reducing inflammation and protecting your joints long-term. Next, supplements are one more tool for reversing joint pain. For many people, they make a meaningful difference by calming inflammation and improving how joints feel every day. The key is choosing the right ones and giving them enough time to work. Omega-3s are among the best studied supplements for joint health. They can reduce joint pain and stiffness, lower inflammatory markers. Sources of omega-3s include fish oil supplements and fatty fish in the diet. Consistency matters more than taking these now and then. Low vitamin D is very common, and even in people that live in warmer climates. When levels are low, muscles and bones often become more sensitive to pain. People may feel achy, weak, or sore without realizing vitamin D is part of the problem. Correcting a deficiency can noticeably improve joint pain and muscle strength in some people. Turmeric, specifically its active compound curcumin, has natural anti-inflammatory effects. In some people, it can noticeably reduce osteoarthritis pain and joint pains caused by inflammation. Turmeric and curcumin are not well absorbed. That's why they are often combined with black pepper or made with special technologies like phytosome formulations, nanoparticles, or emulsions to improve absorption and make them effective. Glucosamine and chondroitin have been shown to reduce joint stiffness and pain. Glucosamine and chondroitin tend to work best for osteoarthritis. This is joint pain related to cartilage wear and tear, especially the knees and hands. They're less helpful for inflammatory or autoimmune arthritis, where the immune system is driving the pain rather than cartilage breakdown. Glucosamine and chondroitin work slowly, so they should be tried for about 8 to 12 weeks. If there's no clear improvement by then, they're unlikely to be beneficial and can usually be stopped. Magnesium supports muscle relaxation, nerve signaling, and sleep quality. Since poor sleep and muscle tension amplify pain, correcting low magnesium can indirectly make joints feel calmer and more resilient. Boswellia, an herbal extract used for centuries, works differently. It targets specific inflammatory pathways in the body. It can reduce joint stiffness, swelling, and daily joint discomfort. With supplements, more is not always better. Taking too much can cause side effects, interact with medications, or put unnecessary strain on the liver or kidneys. Supplements can make you feel better, so you should not delay a proper evaluation to see if something more serious is going on. That's why it's important to review your joint pain and supplements with your healthcare provider. Medications are often necessary, and when used correctly, they can be life-changing for joint pain. They work best when paired with lifestyle changes. Medications like ibuprofen and naproxen are called anti-inflammatory pain relievers. They work by blocking chemicals in the body that cause inflammation, which is why they can reduce pain, swelling, and stiffness fairly quickly. For many people, they improve short-term comfort and make it easier to move and function day to day. What's important to understand is that these medications treat symptoms, not the underlying cause of the joint pain. Used too often or long term, they can irritate the stomach, affect kidney function, and raise blood pressure. That's why they're best used not as a daily long-term solution unless you are closely supervised by a physician. Steroids like prednisone and methylprednisolone are powerful medications that work quickly to calm inflammation. They reduce joint pain and swelling by turning down the immune system when it is overactive, which is why they're often used during severe flares. These medications can be very helpful in the short term, but they are best avoided for long-term use. Over time, they can cause side effects like bone loss, weight gain, and increased blood sugar. That's why steroids are best used as temporary tools, used to get inflammation under control while a safer, long-term plan is put in place. For inflammatory arthritis like rheumatoid arthritis or psoriatic arthritis, there are medications designed to control the disease itself, not just the pain. These are called disease-modifying medications. These medications reduce joint damage, preserve function, and improve long-term outcomes. Delaying appropriate treatment with these disease-modifying medications can lead to permanent joint damage. These medications are usually prescribed by a rheumatologist. Joint or soft tissue injections can reduce localized inflammation, improve mobility, and help break pain cycles. They are tools, not cures, and can be very helpful in the right situation. Platelet-rich plasma, known as PRP, uses a concentrated portion of your own blood that is rich in growth factors. These help calm inflammation and support the body's natural healing response inside a painful joint. When injected, PRP may improve pain and function by signaling surrounding tissues to repair damage. Exosomes, which also come from your blood, can be injected into your joint. These exosomes carry anti-inflammatory messengers. These signals may help reduce inflammation and support cartilage and soft tissue health. Both of these treatments are considered regenerative approaches that aim to improve the joint environment. Here's the key message. Diet lowers inflammation, supplements help the body naturally lower inflammation, and medications and injections treat disease when necessary. No single approach works alone. Joint pain improves best when inflammation is addressed, movement is restored safely, metabolic health is supported, and the correct diagnosis is made early. Thanks for watching. If you found this helpful, please share this video with a friend. Also subscribe and leave a like. This is educational information only. See you in the next one.